as we age, our mind, at least from an athletic standpoint, thinks we know what we need to do, but find we just can't quite do it as easily or as quickly as we once did in the past. So learning to accept that and accommodate to that, and becoming playing things more, sports for more enjoyment and exercise as opposed to the thrill of it, if you will. And it's always good to have those competitive juices flowing, but in different modes. And then, of course, as we get older, we have more responsibilities from a family standpoint and a job standpoint, and you can't afford to break your hand or your ankle if it's playing something recreationally and then you're out of work. As we get older, we have more responsibilities. We put on some weight over the course of life. We have job and lives that keep us busy during the week, and we haven't been able to train as we did when we were younger all week to play that weekend competitive game. And then we go out and we're not in as good a shape, and we try to run as fast or jump, and we rupture our Achilles, or we sprain our ankle, or we fall and break our hand or wrist or what have you. That certainly subjects us to, I think, increased risk of activity. So trying to trying to keep yourself as fit as you can, stretching and activity and warm up beforehand, certainly all play a role in injury prevention. So arthritis is a chronically progressive situation. So arthritis is what it is, again, is a wearing away the protective cartilage cushion that protects our joints. And it's a unique structure in that it has no blood supply, it has no nerve supply. So once that cartilage cushion is damaged, our body is not able to repair it. So it becomes a matter of managing the symptoms. Best thing that patients can do to manage their symptoms is keep their weight down. Every step that we take, our hips and knees see 3 to 5 times of our body weight with walking. And with running, it's up to 7 to 9 times of our body weight. So if we're carrying extra weight and we have a bad knee or a bad hip, those impact running, jumping activities are just going to put more stress on that joint and cause more pain. It's not necessarily harmful to do those things, but it's a matter of what they can tolerate, and it will just accelerate that degenerative process. Once patients come in to see me, and sometimes they come in with a hip or knee that's been bothering them for a year or so, and the first x-ray we get shows that it's a completely worn out knee. That cartilage cushion is just worn away. At that point, the damage is done. There's no cure for it or no going back and rebuilding it, if you will. It's a matter of managing the symptoms. And if someone really loves to do some running for exercise or plays basketball or men's league basketball or what have you, then I encourage them, do that for as long as you can. If it's something you have to do, use some maybe over-the-counter medicines preemptively to allow you to do those things if it's just something you just can't imagine not doing. Because once your symptoms continue to progress and they become more limiting where you can't do it, a joint replacement is not going to allow you to go back and do that. Joint replacements are not meant to allow you to go back and be a competitive athlete or run or jump or play basketball or football. We do it for pain relief, and patients are often able to be very active. They're able to walk for exercise, unlimited walking, an elliptical machine, bike, swim, garden, golf, hike, all those type of things. Someone who has younger children can certainly coach a kid's team and those type of things, but I discourage patients from playing, men's league softball or business league soccer or flag football or those type of things, because that extra force with the running, jumping, impact activities are just ultimately going to result in premature wear of the implants and early failure.